My name is Dr. Samuel Thompson, and I want to share a perspective on heart health that goes beyond the standard advice you might hear in a typical 5-minute office visit because your blood pressure is one of the most important markers of your long-term survival. Serious, high blood pressure is often referred to by medical professionals as the silent killer because it can quietly damage your arteries and strain your heart for years without causing a single headache or dizzy spell until a major event occurs. When I talk to my patients about their readings, I explain that blood pressure is simply a measurement of how much force your blood is exerting against the walls of your blood vessels as it travels through your body. Concerned, if that pressure is too high, it starts to create microscopic tears in the delicate lining of your arteries, which triggers a cycle of inflammation and scarring that makes the vessels stiff and narrow. This narrowing creates even more pressure and forces your heart to pump much harder to get oxygen to your brain and kidneys and other vital organs. While many people believe that high blood pressure is just an inevitable part of getting older or a result of bad luck I have seen through years of clinical practice, that specific nutritional deficiencies play a massive role in why these numbers climb. We are going to explore 5 essential vitamins that have been backed by high-quality research and authority sites like the Mayo Clinic and the American Heart Association to help you drop those points and protect your vascular system. The first nutrient that is absolutely vital for anyone struggling with hypertension is vitamin C because its role in vascular health is much deeper than just supporting your immune system. Many people are surprised to learn that vitamin C acts as a natural diuretic, which means it helps your kidneys flush out excess sodium and water from your bloodstream. According to research published in the American Journal of Clinical Nutrition, patients who took a daily supplement of vitamin C saw a significant reduction in both their systolic and diastolic blood pressure readings. This happens because when you reduce the amount of fluid in your pipes, you naturally lower the pressure inside those pipes, just like turning down a faucet. Vitamin C is also the primary building block for collagen, which is the structural protein that gives your blood vessels their strength and their ability to stretch. If your body does not have enough vitamin C, your arteries become less flexible and more prone to the hardening that drives blood pressure through the roof. Furthermore, vitamin C helps protect a molecule called nitric oxide, which is your body's natural way of telling your blood vessels to relax and open up. When you have high levels of oxidative stress in your body, your nitric oxide gets destroyed quickly, but vitamin C steps in to neutralize those harmful free radicals and keep your vessels wide and relaxed. This is why I always emphasize the importance of getting plenty of vitamin C through foods like bell peppers and citrus fruits and strawberries, or through a high-quality supplement if your diet is lacking. The second heavy hitter in our lineup is vitamin D, which is actually a powerful hormone that communicates directly with your DNA to regulate your cardiovascular system. A massive study conducted by the University of South Australia analyzed the health data of over 100,000 people and concluded that there is a direct causal link between vitamin D deficiency and the development of hypertension. Your kidneys use vitamin D to manage a system called the renin-angiotensin aldosterone system, which is the master control center for your blood pressure and fluid balance. When your vitamin D levels are too low, this system goes into overdrive and produces too much of an enzyme called renin, which causes your blood vessels to tighten up and your body to hold on to too much salt. Clinical trials have shown that when people with a deficiency start taking vitamin D, their systolic blood pressure can drop by several points because the body finally receives the signal to stop overproducing these constricting hormones. It is estimated that up to 40% of adults are deficient in vitamin D because we spend so much time indoors and away from the natural sunlight that our bodies need to produce it. I always encourage my patients to get their blood levels tested because knowing your vitamin D status is one of the easiest and most effective ways to take control of your heart health. The third essential vitamin we must discuss is vitamin B2, which is also known as riboflavin because it has a unique ability to help people who have a genetic predisposition to high blood pressure. There is a common genetic variant called the MTHFR gene that affects how the body processes certain nutrients, and people with this variant are much more likely to suffer from hypertension. Researchers at the University of Ulster found that giving a small amount of vitamin B2 to people with this genetic trait resulted in a dramatic drop in blood pressure that was comparable to some pharmaceutical medications. Riboflavin acts as a key for an enzyme that helps lower levels of homocysteine, which is an amino acid that can irritate and damage the lining of your arteries when it gets too high. By keeping your homocysteine levels in check, vitamin B2 prevents the internal damage that leads to arterial stiffness and high pressure readings. Even if you do not know if you have this specific genetic trait, vitamin B2 is still essential for helping your cells produce energy and keeping your heart muscle strong and efficient. You can find good amounts of riboflavin in foods like eggs and lean meats and almonds and green leafy vegetables. Our fourth essential nutrient is vitamin E, which is a fat-soluble antioxidant that specializes in protecting the fats and cholesterol in your blood from becoming rancid or oxidized. When the cholesterol in your blood becomes oxidized, it turns into a sticky substance that easily attaches to the walls of your arteries and forms plaque. This buildup of plaque narrows the space through which your blood can flow and creates a high-pressure environment similar to putting your thumb over the end of a garden hose. A study published in the Journal of Vascular Research indicated that vitamin E helps maintain the health of the endothelium, which is the single layer of cells that lines your entire circulatory system. When these cells are healthy, they produce the signals necessary to keep your blood flowing smoothly and your pressure stable. Vitamin E also helps prevent blood platelets from clumping together too much, which reduces the thickness of your blood and makes it easier for your heart to pump it through your body. The fifth and perhaps most misunderstood vitamin in our list is vitamin K2 because it is the primary nutrient responsible for telling calcium exactly where to go in your body. Most people know that calcium is good for bones, but if you do not have enough vitamin K2, that calcium can end up in your heart and your arteries instead. When calcium builds up in your arterial walls, they become hard and crunchy like a dry twig, instead of being soft and flexible like a young branch. This condition is known as arterial calcification, and it is a major reason why blood pressure increases as we get older. The famous Rotterdam study followed nearly 5,000 people for 10 years and found that those who consumed the most vitamin K2 had a 52% lower risk of calcification in their arteries. Vitamin K2 activates a specific protein called matrix Glay protein, which acts like a vacuum cleaner to pull calcium out of your blood vessels and move it into your skeletal system. This ensures that your arteries stay pliable and able to handle the pressure of every heartbeat without suffering damage. By combining these 5 vitamins, you are addressing the fluid balance and the hormonal signals and the genetic factors and the oxidative stress and the physical hardening that all contribute to high blood pressure. I have seen patients who were once discouraged by their high readings find a new sense of hope when they realize that they can influence their biology through these natural and scientifically proven methods. It is not about a quick fix or a magic pill, but about giving your body the fundamental tools it needs to maintain a state of balance and health. When you provide your cardiovascular system with vitamin C and vitamin D and vitamin B2 and vitamin E and vitamin K2, you are creating a foundation for a long and vibrant life. I want you to feel empowered to take these steps because the evidence is clear and the results can be life-changing for anyone willing to make their nutrition a priority. Your heart works incredibly hard for you every single second of the day, and it deserves to be supported by the highest quality nutrients available. In my years as a physician, I have learned that the most successful patients are the ones who take an active role in their own care and seek out the knowledge needed to make informed decisions. We are living in an era where we have access to incredible research that shows us exactly how to live better, and it starts with small and consistent choices. Every meal you eat and every supplement you take is an opportunity to send a message of health to your cells and your blood vessels. By focusing on these 5 essential vitamins, you are choosing a path that leads away from the risks of heart disease and toward a future full of energy and vitality. I am committed to helping you understand these concepts in a way that is simple and easy to apply so that you can start seeing a difference in your numbers and how you feel. Your journey to better blood pressure does not have to be complicated or scary when you have the right information and a clear plan of action. Continuing our focus on these life-saving nutrients allows us to look at the specific ways they work together to create a cumulative effect that is much stronger than any single vitamin could achieve on its own. I want to explain to you how the interaction between vitamin D and vitamin K2 is particularly important because they are the ultimate partners for your arterial health and bone density. When you take vitamin D, your body increases its absorption of calcium, but if you do not have enough vitamin K2 to direct that calcium into your bones, it will simply sit in your bloodstream and eventually settle in your heart valves and artery walls. This is why I always tell my patients that these two should be taken together to ensure that your blood vessels stay clear and your blood pressure stays low. Research from the University of Maastricht has shown that this combination can actually help improve the flexibility of the carotid arteries, which are the main vessels that supply blood to your brain. This means that by following this protocol, you are not just lowering your blood pressure points, but you are also actively reducing your risk of stroke and cognitive decline as you age. It is also important to revisit vitamin B2 because its impact on the MTHFR gene is a perfect example of how targeted nutrition can overcome a genetic disadvantage. Many people feel like they are destined to have high blood pressure because their parents or grandparents had it, but science shows us that the right vitamins can change the way those genes are expressed. A clinical trial led by the University of Ulster confirmed that riboflavin supplementation can drop systolic blood pressure by up to 13 points in individuals with this specific genetic profile, which is an incredible result for such a simple and inexpensive nutrient. We also have to consider the role of vitamin E in its various forms because modern research is showing that a mixture of tocopherols and tocotrienols provides the best protection for your arteries. These different forms of vitamin E work in different areas of the cell to neutralize inflammation and prevent the buildup of cellular waste products that lead to vascular aging. The Journal of Nutritional Biochemistry has published findings suggesting that vitamin E can significantly decrease the production of a protein called endothelin-1, which is one of the most powerful vasoconstrictors in the human body. When you have less endothelin-1 in your system, your blood vessels can stay in a more relaxed state, which naturally leads to lower readings on your blood pressure cuff. Now let us talk about vitamin C again, but specifically its ability to regenerate other antioxidants like vitamin E after they have done their job. This process is called antioxidant recycling, and it ensures that your body has a constant defense system against the damage caused by high blood sugar or environmental toxins. When these vitamins work as a team, they provide a 24-hour shield that protects your heart even while you are sleeping. I have observed in my clinic that patients who stick to this nutritional plan often report feeling a significant boost in their overall energy levels because their heart does not have to work as hard to move blood through the body. This efficiency means that more oxygen and nutrients are reaching your muscles and your brain, which helps you feel younger and more alert throughout the day. You should also be aware that the American Heart Association recently updated their guidelines to emphasize that lifestyle and nutrition should always be the first line of defense for people with stage 1 hypertension. This is a major shift in the medical world because it validates the power of the natural strategies we are discussing right now. To get the most out of these vitamins, I suggest that you also monitor your intake of minerals like potassium and magnesium because they work alongside these vitamins to regulate the electrical signals that tell your heart when to beat. A heart that beats with a steady and calm rhythm is much less likely to develop the high pressure patterns that lead to long-term damage. I also want to remind you that the quality of your supplements matters immensely because your body needs bioavailable forms of these nutrients to get the best results. For example, you should look for vitamin D3 instead of D2 and seek out the MK7 form of vitamin K2 because it stays in your bloodstream much longer and provides more consistent protection for your arteries. When you are looking for vitamin E, it is better to find a natural source rather than a synthetic one, because the body recognizes and uses natural vitamins much more effectively. I believe that everyone has the right to understand their own body and to have access to the tools that can save their life without unnecessary complications. It is incredibly rewarding to see the relief on a patient's face when they realize that they are finally back in the driver's seat of their own health journey. High blood pressure is a serious condition, but it is also a signal from your body that something is out of balance and needs to be addressed with care and precision. By focusing on these 5 essential vitamins, you are answering that call for help and providing the support your cardiovascular system has been craving. I want you to remember that every healthy choice you make today is an investment in your future self and your ability to be there for your family and your loved ones. We have looked at the evidence from authority sites and the results from proven research papers because I want you to have total confidence in this path. The connection between what we put in our bodies and how our hearts perform is undeniable, and it is the most powerful lever we have for long-term wellness. I encourage you to talk to your healthcare provider about how to incorporate these vitamins into your specific routine based on your latest blood work. You are not alone in this process, and there is a wealth of scientific knowledge ready to support you every step of the way. Your heart is a magnificent machine that is capable of incredible repair if it is given the right environment and the right building blocks. As we have discussed today, vitamin C and vitamin D and vitamin B2 and vitamin E and vitamin K2 are those building blocks. They work to soften the pipes and regulate the hormones, and clean the blood and protect the cells from the wear and tear of daily life. I hope you feel inspired to take action and to see for yourself how much your blood pressure points can drop when you give your body exactly what it needs to thrive. Thank you for taking the time to invest in your health knowledge because it is the most valuable asset you will ever own. I am Dr. Samuel Thompson, and I am honored to be a part of your journey toward a healthier and stronger heart. You have the power to change your numbers, and you have the tools to protect your future, so let us get started on this path to better health today.